Bonjour à vous. I will speak today in English. I'm apologizing for that. It was a great practice opportunity for my French today. I do understand it, but I don't speak it well, so I'm going to speak in English. Thanks a lot for the invitation to be here. My impression is that we really can learn a lot from the way the French ecosystem is networked. I think it's very impressive to see. So I have the opportunity today to speak a bit about what we do with my company, Kranus Health. We are essentially tackling virtual care in one specific sector, which is urology. A few things in summary about Kranus. We're still a quite young company, just about 3.5 years old. But we have grown quite substantially since then. The company was started actually in Germany. Now we have 3 offices, also one in Paris. I spent a lot of time here. And also from our capital raised, we raised around 25 million in total. Half of that capital is from France. So you could say we're by now really a French-German company, half-half. We're about 100 employees by now, and quite a big leadership team. I think that's we can skip that. But I think what's interesting to see is, you know, what was the idea of Kranus? We looked at the digital health landscape, and I think what you can see that there's a lot of companies that are tackling mental health. There's also a lot of companies that were tackling general health or back pain, these kind of topics, and also at that time femtech. But what we did not see is companies that really focus on urology. And that is what we do. In a nutshell, I think I have 2 beliefs that really stand for what we do. On the one hand side, there are a lot of taboos still around urology. So there's a lot of things, a lot of diseases that are not being talked about, which is something that really the patients suffer from and something we need to get better at. And the other thing is that I think it is time to move more to something I call medicine 2.0, really treating patients in a more root cause oriented way as opposed to just giving pills. This is what we do. So we have actually by now a variety of digital health therapies tackling diseases ranging from erectile dysfunction to incontinence, both in men and women actually, all the way to prostate cancer, so uro-oncology. What all of these therapies have in common, they're delivered via your smartphone, so via digital technology, and they are root cause oriented therapies backed by clinical science. So we are like a pharmaceutical company with all the elements of a pharmaceutical company, market access, regulatory, and then of course clinical. We back all our therapies with randomized controlled trials because we only seek reimbursable therapies as a medical company or as a pharma company would. There are some things that I think are important when you do digital health, which is of course new to patients as well as doctors. Fundamentally, I believe throwing over a product and leaving the patients all by themselves is not going to work. We are all humans, and I think we benefit from combining digital therapeutics with remote support, with one-on-one support, which is something that we do from the start. And we are, of course, able to personalize the therapy to each individual patient based on their comorbidities, based on their individual health profile, and based on how they proceed through the therapies. Something we're quite proud of. We've been able to reach a lot of patients. We have 2 fully reimbursable DIGAs already in Germany, which is the equivalent to the PECAN or LPPR in France, which is also something we're working on right now. So have quite a large team here in France working on PECAN, of which we hope to be some of the first companies. We've treated more than 15,000 patients, and I think specifically what I think is so important is that you need to win the doctors. I think that is something underestimated by a lot of companies in digital health. It is the distribution of the therapies. They are not only new to the patients, but also to the doctors. So we've invested quite heavily in our own sales force, which we have both in Germany and France. So really sales field reps that visit doctors on a day-to-day basis. which by now we have in Germany, I think 1,000, 1,300 prescribers, which is about a third of all urologists in Germany. And we have a 70% brand recognition among these urologists already, which I think is something that is, very important to really win an ecosystem. That's my last slide. I think, what is the outlook? I really think that we're on the verge of something great in Europe, something that started really in Germany and France, where we're both present, but I'm hoping we can move towards a harmonized framework for the reimbursement of these therapies in the years to come, as well as expanding then, of course, our portfolio. So that's Kranus in a nutshell, and thank you for the attention.